therapy with a novel quadripolar lead decreases complications at 6 months.
Welcome to everybody. My task is to present the MORE-CRT trial. MORE-CRT is the acronym of a study exploring the field of cardiac resynchronization therapy. Cardiac resynchronization therapy is a therapy with well-known efficacy for appropriately selected patients with heart failure. It is based on stimulation of the left ventricle with a lead, which is usually a bipolar lead, put within the coronary sinus to stimulate the left ventricle. The study design of this trial was to demonstrate that using a novel quadripolar left ventricular lead produced by St. Jude Medical can result in easier implantation procedures and in a lower rate of lead-related complication as compared with the standard, so as compared with currently used left ventricular bipolar leads. The study was prospective, open, parallel, multi-center study approved by local ethic committees and compared the St. Jude quadripolar lead with the standard bipolar leads from any manufacturer, either St. Jude or non-St. Jude. The study had a 6-month time period and enrolled more than 1,000 patients randomized 2-to-1 to the 2 arms of treatment. The centers participating were from 13 countries. The enrollment was performed in less than 2 years. More than 1,000 patients were randomized, and here we have the 2 arms of treatment, and more than 1,000 patients contributed to the primary endpoint. If we move to the result, we can first say that the study was positive. The freedom from combined intra- and postoperative events related to the left ventricular lead was in favor of the quadripolar lead. There was an improvement by close to 12%, highly statistical significance in favor of the quadripolar left ventricular lead. We can also analyze the primary endpoint in terms of rate of events. Again, we have an important advantage for the quadripolar lead. The relative risk reduction is in the range of 40%. If we consider the absolute risk reduction is 9, so the number needed to treat is 11. This means that every 11 patients will treat with a quadripolar lead instead of a conventional bipolar lead, we avoid an event related to placement of the left ventricular lead. We can also analyze the single components of the primary endpoint. The intraoperative events were markedly reduced, more than halved by use of the quadripolar lead. This means that every 13 patients we treat with a quadripolar lead, we avoid 1 complication related to left ventricular placement. And here we have the details of the primary composite endpoint, just to say that 1 in 20 patients with the control implant had an unsuccessful implant. It was reduced by use of the quadripolar lead. So we can move to the conclusions. In this large prospective randomized trial, the primary endpoint of freedom from intraoperative and postoperative lead-related events was significantly better in patients implanted with the quadripolar quartet left ventricular lead as compared to patients implanted with standard bipolar left ventricular leads produced by any manufacturer. The driver of benefit was a marked reduction in intraoperative left ventricular lead-related events, more than halved in comparison with the conventional bipolar leads. And so the performance and safety of this quadripolar lead provide more options to clinicians to effectively manage common pacing complications as compared to system based on bipolar leads. This can result in improving the efficiency of CRT in appropriate patients.